May I now invite the next speaker, Professor Dr. Latha Ravichandran, Head of the Department Pediatrics, Srihar, to deliver her talk on vaccination in children with disabilities. Over to you, ma'am.
It's my pleasant duty to introduce Professor Latha Ravichandran, the HOD Pediatric Department, HOD of Pediatrics Department at Srihar, and she is specialized in adolescent medicine, and her favorite area I think is adolescent medicine besides pediatrics. Over to her to talk about immunization, which is the bread and butter of pediatricians. Next to fever, I think immunization tops the list. And these children with special needs, I think we have some difficulties in.
Being the last speaker, I am having an advantage as well as a disadvantage. But then I would like to move on the advantage in the sense vaccination, as sir has pointed out, is a very important bread and butter for our practice. Just bringing right in front of you a clinical scenario which normally happens in our office practice. Tara is a 3-year-old girl, is able to make many vocalization, is able to say one recognizable word. Tara says juice, will say juice, and which she will pronounce as oos. Throughout the day, Tara cries, falls on the floor to gain access to food, obtain favorite toy, and when she wants to be picked up. Tara recently began attending an early childhood special education classroom for learners with autistic spectrum of diseases. Her parents are now concerned whether routine vaccination caused the symptoms, hesitant to continue vaccination. I think all of us would agree that we have been in this position many times, and it is our duty to take care of the children. I'm starting with this problem is only to, jot off, the fag end of the day when everybody is almost sleeping, or, it's the end of the conference, just to put in front of you a common scenario that happens in our clinics. But the objectives of my talk for the next 10 minutes or so would be to just touch upon disabilities categories, vaccine preventable diseases in children with disabilities, current status of immunization in children with disabilities, a literature review, challenges to immunization in children with disability, and what are the predictors of a good immunization status in children with disability, and of course some of the recommendations in special situations. The need for reviewing the definition on a disability is any condition of the body or mind that makes it more difficult for the person with the condition to do certain activities. So if they can't do the activities, there is activity limitation, and interact with the world around them, participation restriction. So the International Classification of Functioning Disability, which states that disability is an umbrella term for impairment, activity limitation, or participation restriction, which results from, this is where we are very important, interaction between the person with health condition and environmental factors, which includes physical environment, attitudes, and personal factors like age, gender, and coping mechanism. So these are all the various categories of disabilities that you can see in children. Could be a learning disability, hearing disability, visual disability, mental retardation, physical impairment, speech impairment, but not limited to that. So how does it actually works? For an example, somebody who is having a cataract prevents passage of light, that causes an impairment. Inability to read or move around becomes a disability or activity limitation, and the handicap is actually exclusion from school. I'm just giving an example. So some children are born with disabilities or a health condition or an impairment from birth, while others may experience or acquire disability after a birth as a result of chronic illness, injuries, mental health problems, birth defects, malnutrition, communicable disease. Here I am insisting on the diseases because the physical condition which all live due to chronic illnesses is also considered to be a disability. So physical disabilities, cognitive or intellectual disabilities, mental retardation, emotional behaviors, anxiety, depression, phobias, and we have the attention deficit hyperactivity disorder, and the sensory, visual, hearing, and speech language disorders. In addition, the autistic spectrum disorder, where we know it is characterized by impairment in social interaction, verbal and non-verbal communication, and by restricted and repetitive behavior, specific learning disabilities, and chronic health conditions. This quick review puts us to, just to remind, as pediatricians, we have a role everywhere. They come to us, it's not always we see normal children, but then we see this spectrum coming to us in our practice. So let us go through some of the things that can happen. What are the vaccine preventable diseases and the children with disabilities? What is it happening? This data from the WHO suggests 15% of the world population has some impairment in function, with 2 to 4% having significant difficulties with activities of daily living. So that is a vulnerability within a vulnerable group. You have a higher double jeopardy over there, which means it's an extremely specific group that we are addressing as a special category, and that how we review the immunizations in them. Underlying disability, particularly physical disability or disability related to prematurity, predisposes an individual to a wide range of respiratory illness and more severe respiratory compromise for viral and bacterial infections. So actually when you see, there is a predisposition for the infections which are generally preventable or when vaccine preventable. Disability factor is a factor in a disproportionate number of hospitalization and complications, including death from varicella and influenza. So now we are bringing into some of those diseases which can cause death and morbidity and mortality. Immunization is the most successful public health initiative of all times, through prevention of death and reduction in disease severity, complication, and disability. But we are concentrating on immunization as a prevention of a disability. But now we have to change ourselves to look into how we can augment our immunization, the regular ones, with those children already having a disability. Effective immunization programs also improve health equity for vulnerable groups in society who have a higher burden of vaccine preventable disease, which means, is there an equity? Do all of the disabled children have the same proportion of vaccination as in the general population? People with disabilities are vulnerable to complications from vaccine preventable diseases, and every effort should be made to ensure equitable access to immunization for this population. So this disconnect is identifying need for the prevention of disability by immunization against VPDs and an extra effort to ensure optimal protection in those with existing disability. So some of the studies on status of immunization coverage in children with disabilities. Recent studies, people with disabilities have a lower rate of immunization uptake across a range of different vaccines than they typically develop peers. So while we are looking into the general population for 100% and of immunization, but there is a distinct difference. Children with disability, the percentage of coverage is much lesser even when compared to their peers. Disability predicted incomplete vaccination, including, these are some of the studies which have been done in girls in non-mainstream schools, children with congenital malformations, trisomy, and autistic spectrum of disorders. Why and what reason? Yes, that is the next exploration that we may have to do. Other studies aim to explore the acceptability of HPV vaccines among women with physical disabilities. 2 studies examined parental decision making about vaccines after a diagnosis of ASD in their child. Both these concluded that parents are more likely to miss or delay immunizations after their children is diagnosed of an autistic spectrum disorder, suggesting persisting concern about the disproved link between vaccination and the autism. So these, I'm just projected some of the studies which are here. You can see that in one study, to determine if parents change or discontinue the child's vaccination schedule after ASD, it says 50% changed or discontinued. And to evaluate vaccination rates of children with inborn errors of metabolism, we know many of them are susceptible to infections. Find lower rates in children with IEM overall, with lowest with those with high risk of decompensative. And for live vaccine, most common reason being hesitant concerns about adverse reactions. To describe acceptability of HPV, 17% vaccinated against HPV, 90% providers said they vaccinated against HPV. Main reason why they didn't was parent refusal. You see, there is a clear concern on the parents' decision about the immunization for their children. Youth with autistic spectrum of disorders are significantly less likely to receive immunizations. 19.2% of the children with CP, the next group, were not up to date with immunization compared to 6.4 to 8% in the general population. So all of these studies are definitely telling the coverage when we talk about general coverage with this specific group, which is constituting around 15%, there again there is a significant reduction in the coverage for immunization. So what are the challenges in immunization of children with disability? UNICEF clearly articulates the intersect between disability rights, health, immunization, and highlights that inequity in the access to immunization for children, young people and adults with disabilities, and the subsequent impact which it has on the health. Identifiable factors could be due to access to healthcare service, exclusion from healthcare initiatives, and a lack of understanding of the safety of immunization for those with disability. I would also add the various myths that is along with that, which they need to have clarification about. UNICEF highlights the need to better understand the factors that influence immunization practices for this population and to advocate for the research. I think this is a very specific group. A lot of research on what are the gaps and why does this happen would actually help us also to create awareness and also to improve the immunization coverage. There must be certain predictors which will say, in these disabled children, what are those predictors which indicate the coverage will be good or the immunization? We are still talking about the primary immunization. As in the general population, all vaccines are recommended for children with disability, with some exceptions which we'll be talking about. Regular health checkups, children who come for a regular follow-up, recommendation to immunize by a healthcare provider, which means a nursing provider or the first contact physician plays a vital role, and their knowledge on the vaccine or immunizing children with disability is important. Interventions to improve confidence and uptake in immunization by general population as well as in the specific population. Beliefs and concerns about on the other health professions such as GPs and immunization nurses have about recommending vaccination to people with disability. So common concerns and some special situations that we may want to talk about. This is the common understanding. Does vaccine or any component of the vaccine increase the incidence of ADHD among children? But these are clear-cut studies which say that is thimerosal exposure from the vaccine does not increase the risk for any ADHD disorders, because this is a common misconception that is going on. Andrews and his colleagues compared the same with another 1,10,000 children, and again the receipt of thimerosal containing vaccines was not associated with development of ADHD. And the last thing was, getting too many vaccines, does it cause a problem? The study also says it does not. Autism and vaccine. We are all aware that autism is often associated with MMR and measles vaccine, and lot of data has been circulated from United Kingdom regarding which has created concerns. But these are some of the two studies which says vaccines don't cause autism, and we are to give the live vaccine provided that there are no other contraindication. The regular vaccination should be given for all children with disability, and the ingredients do not cause autism. Then comes the seizures. These are some of the recommendations. Vaccination should be performed without contraindication in children with febrile seizures that may occur with normal population as well as children with disability. The risk of febrile seizure should not discourage parents from vaccinating their children. Vaccination should be performed without contraindication in children with idiopathic or symptomatic epilepsy. Risk of epilepsy should not discourage parents from vaccinating their children. Vaccination should be performed without contraindication in children with epileptic encephalopathies. We have the Dravet and West syndrome, and the possible risk of epileptic encephalopathy should not discourage the parents from vaccinating the children. Often it is the cerebral palsy children whom we are refusing the DPT. There is a lot of concern, but the point is that they have to receive the routine immunizations. Among the physical disabilities, the most common ones, those are on the immunosuppressive therapy. Killed vaccines are safe. Live vaccines, children receiving only oral corticosteroids in high doses, that's when live vaccines are not indicated. That is more than 2 milligram per kilogram per day, or those weighing more than 10 kg, or 20 milligram per day or its equivalent for more than 2 weeks, they should not receive the live vaccines. Children on lesser doses of steroids or those on inhaled steroids may safely be given in the vaccines as appropriate for the age. And children on immunosuppressive therapy other than corticosteroids should avoid live vaccines. Most of the time, this treatment is associated with children with other disabilities also. Then coming the chemotherapy and radiotherapy, those children on malignancies. Influence of cancer per se on immune function is minimal and does not contribute to a major extent in inducing immunocompromised state. Total immunoglobulin concentration, specific antibody concentration to already given vaccines are normal at the time of diagnosis, indicating that the effect of cancer on the adaptive immune system is likely to be small. However, chemotherapy for cancer causes major secondary immunodeficiency. The effects of radiotherapy on immune functions are likely to be small in comparison to chemotherapy. So patients aged more than 6 months with hematological malignancies or solid tumor malignancies, except those receiving anti-B cell antibodies or intensive chemotherapy, such as for induction or consolidation chemotherapy for acute leukemia, should receive inactivated influenza vaccine. There are 2 vaccines which we want to promote in general for all those with disability. One is the pneumococcal vaccine and the influenza vaccine. Here the choice would be, we have to be careful in deciding what kind of an influenza vaccine you want to give. And if there is a state where there is an immunocompromised, inactivated influenza vaccine is preferred. I give an example. Child with Duchenne muscular dystrophy, they are recommended influenza vaccine because that's caused a lot of morbidity. However, if they are on steroid therapy and high steroid therapy, you would want to prefer an inactivated one than a nasal one. So the pneumococcal conjugated vaccine is the other thing which we have to promote, because most of the causes of death in many of the disabilities are respiratory illnesses. See, these are several other examples of specific situations which I am not going to talk about. So I would like to summarize. Most of the children with immunodeficiency, our target will be to reinforce all the regular immunization, exception to the situation like an immunosuppression where you may have to modify it. Pneumococcal vaccine and influenza vaccine are the 2 that we have to promote in most of them. The myths regarding ADHD association with the vaccines as well as autism and the vaccination has to be clarified by regular follow-up, talking to the patient, education, and we need not only to educate the patients but the primary care providers who are the nurses as well as the general practitioners. Children with disability are vulnerable to VPDs as much, and their complications and every effort should be directed towards equitable access to immunization. Efforts to ensure optimal protection through immunization in those with existing disability should be made. There must be adequate training and education to all service providers, and frequently asked questions should be clarified. Improved confidence of parents through interaction, follow-up care and education. The predictors have already said. More research on vaccination of children with disability, current status, factors influencing and gaps existing. And of course, we have to propagate the recommendations and guidelines. There is a separate module for even at the undergraduate level by the National Medical Commission on disabilities. But I think what our role we can play is to give a recommendation for the primary care on what are the vaccines that need to be done and what sort of a counseling that needs to be done to take care of these children with disabilities. Thank you very much for the opportunity.
Thank you, madam, for your excellent talk on immunization of children with disability. You have stressed on the importance of educating not only the parents, the healthcare provider also about the importance of vaccinating these children and also how to go about the problem, whatever they are facing. Thank you very much.
Thank you, sir. Thank you.